As a heart surgeon, I'm warning, your heart is dying without this vitamin. If you're over 60, let me speak to you directly, not as a YouTuber, but as someone who's seen too many heart conditions that could have been prevented with one simple step. Most seniors think heart attacks happen suddenly, without warning. But in truth, your heart whispers before it screams. Fatigue, breathlessness during short walks, swollen ankles, poor sleep, dizziness, these are all red flags that your heart is not getting what it needs. And while medications and surgeries help, there is something even more powerful that many seniors overlook: proper nourishment. Your heart is a muscle, and like every muscle, it needs the right vitamins and minerals to beat strong, pump blood efficiently, and protect you from deadly events. In this video, I'm going to walk you through 5 essential nutrients your heart is quietly begging for, and if you're missing even one, the consequences could be devastating. I'll save the most critical one for last, the one I recommend to every patient over 60. So stay with me, because this isn't just about living longer, it's about living stronger. And by the end, you'll also learn about a simple daily tool that thousands of seniors are using to protect their hearts starting today. 5. Coenzyme Q10. Coenzyme Q10 is one of the most underrated nutrients for senior heart health. As we age, our body's natural ability to produce coenzyme Q10 declines dramatically. This nutrient is vital for energy production inside every heart cell. Without enough of it, your heart cannot beat efficiently, and your energy levels may plummet. Many seniors complain about fatigue, shortness of breath, or chest discomfort, and often, low coenzyme Q10 is part of the puzzle. It also plays a key role in maintaining healthy blood pressure levels. Some seniors who take certain heart medications, especially those used for high cholesterol, lose even more coenzyme Q10. That's why supplementing it becomes so important. When coenzyme Q10 levels are restored, many seniors report feeling more energetic, clear-headed, and even happier. It's like refueling your heart's battery. The change is not instant, but over a few weeks, it builds strength from within. You should never underestimate how hard your heart works for you every second. Give it the fuel it needs. Talk to your doctor before adding coenzyme Q10, but know that this little nutrient could be the missing link in your daily health routine and your defense against heart failure or dangerous fatigue. 4. Magnesium. Magnesium is a mineral that quietly supports over 300 different functions in your body, but it plays a starring role when it comes to your heart. If you've been dealing with irregular heartbeats, nighttime cramps, or high blood pressure, magnesium deficiency might be the reason. This mineral helps your blood vessels relax, improving circulation and easing the workload on your heart. Without enough magnesium, your heart rhythm can become unstable, your blood pressure can climb, and you may even feel anxious or restless. Seniors often lose magnesium through medications, poor diet, or simply age-related changes in absorption. Many foods lose their natural magnesium during processing, leaving your diet empty of this essential mineral. Supplementing magnesium can help restore balance, support better sleep, and improve your heart's rhythm. But always choose the right form and dosage. Some types may cause stomach upset. That's why checking with your doctor is important before starting. Magnesium does not work alone, but when combined with other heart-supporting nutrients, it acts like a shield. And here's something crucial: many seniors now track their heart symptoms and magnesium intake using a daily routine tool. Check the link in the description and pinned comment for the Senior Health app. 3. Potassium. Potassium is another essential mineral that keeps your heart rhythm steady and your blood pressure in check. Most seniors know that sodium raises blood pressure, but very few understand how potassium lowers it. This mineral helps your blood vessels stay open and flexible, which improves blood flow and reduces strain on the heart. It also balances fluids, supports kidney function, and helps nerves communicate with the heart. When you don't get enough potassium, you may experience muscle weakness, irregular heartbeat, or even heart palpitations. And here's the problem: processed foods and salt-heavy diets are everywhere, which can throw off your potassium-sodium balance. Seniors who take diuretics or medications for high blood pressure may also lose potassium through urine without even realizing it. Natural sources like bananas, avocados, sweet potatoes, and spinach are helpful, but sometimes they're not enough. A blood test from your doctor can confirm your potassium levels, and if they're low, supplements may be recommended. Getting this mineral right is like tuning the strings of a guitar. It keeps your heartbeat in rhythm and your body in harmony. 2. Omega-3 fatty acids. Omega-3 fatty acids are powerful, heart-loving nutrients found in fatty fish like salmon and sardines. These healthy fats reduce inflammation in the blood vessels, lower triglycerides, and help regulate heartbeat. If you've been told your cholesterol is high or your blood pressure is creeping up, omega-3s might be your best friend. As a heart surgeon, I've seen patients with clogged arteries who made major improvements by simply adding omega-3s to their diet. They help prevent plaque buildup, reduce blood clot risk, and keep your heart rhythm stable. For seniors, this is crucial because aging bodies are more prone to inflammation and hardening of the arteries. Omega-3s also support brain function and joint mobility, making them a smart choice beyond just heart health. If you don't eat fish regularly, you may need a high-quality omega-3 supplement. Make sure it contains both eicosapentaenoic acid and docosahexaenoic acid. These are the most beneficial forms. And remember, consistency is key. Taking omega-3s for 1 week and stopping won't help. Your heart needs steady support every single day. Thousands of seniors now use a simple daily app to track their omega-3 intake, monitor blood pressure, and avoid dangerous complications. You'll find the link in the description and pinned comment. 1. Vitamin D. Now let's talk about the most important vitamin of all, vitamin D. This is not just a bone vitamin. It's a full-body protector, especially for your heart. Seniors with low vitamin D levels have a much higher risk of heart disease, high blood pressure, and even sudden cardiac death. Why? Because vitamin D supports your blood vessels, helps regulate blood pressure, and reduces inflammation throughout the body. It also strengthens the heart muscle itself. Yet, over 70% of seniors are deficient and have no idea. As you age, your skin loses the ability to make enough vitamin D from sunlight. Add in time spent indoors, and your levels can fall dangerously low. Symptoms include fatigue, mood changes, bone pain, and even chest discomfort. But the scariest part? Often there are no symptoms at all, until something serious happens. This vitamin is so critical that I test every heart patient's levels. Low vitamin D weakens your defenses. The good news? It's easy to fix with proper sunlight, food, and doctor-recommended supplements. But do not guess, ask your physician for a simple test. Fixing your vitamin D may be the single most powerful step you can take today to protect your heart from sudden failure tomorrow. Your heart is not just a pump, it's your engine of life. And after 60, it deserves every ounce of support you can give it. These 5 nutrients are not just nice to have. They are the building blocks of a strong, healthy, resilient heart. If you felt tired, short of breath, or just not yourself lately, your heart might be whispering for help. Listen closely. And remember, staying consistent is the key. Don't just learn, act. Start by tracking your symptoms, routines, and nutrient intake with the Senior Health app thousands already use every day. It's simple, safe, and powerful. Check the link in the description and pinned comment. You'll be surprised how much easier it becomes to manage your health once you have the right tools in your hands. But always remember, before starting any new vitamin or supplement, talk to your doctor. Stay strong. Stay informed. And take that next step today, not just to live longer, but to live with more energy, strength, and joy. Your heart deserves that. You deserve that.